video, I will be talking to you about expressing breast milk. This is an important technique that you as a mother can learn to help you feed your baby breast milk when you're not around. As a breastfeeding mom, in your maternity leave, you begin to think about the time when you have to return to work. You wonder if you can go to work and still continue breastfeeding. Yes, you absolutely can. Breastfeeding is mainly determined by how motivated you are to breastfeed your baby. Everything else will fall into place. There can be times when you have an emergency or situations where you're not able to be around to feed your baby. This is when expressing your breast milk becomes very useful. You can express breast milk either by hand or with the help of a breast pump. You can use either of the techniques based on whichever is convenient for you. However, expressing by hand is a very economical and convenient technique as there are no equipments needed and the bacterial contamination is low. So these are some few simple steps which you can follow to express milk by hand. Firstly, choose the container, a steel or glass one with a wide opening to collect the breast milk. Next, ensure that you wash and dry the container thoroughly. Then get prepared for expressing. Wash your hands and breast with water. Find a comfortable place to sit with adequate backrest and then place the container in front and below the nipple to collect the expressed breast milk. Let me show you how it needs to be done. First, you can start by massaging your breast in a circular motion. You can do this with one hand like this, or using both hands, one above and one below, massaging the breast in a circular motion. You can do either technique for about 2 to 3 minutes till you're comfortable. Now, this is the nipple and this dark region around the nipple is called the areola. Once we have massaged the breast, we need to stimulate the nipple and the areola with fingers. Now, support the breast with one hand and use the forefinger and thumb of the other hand to hold the breast tissue just behind the areola. Remember, pressing only the nipple will block the ducts and not allow the release of milk. So make sure your fingers and thumb are placed behind the areola. Now you press towards the chest with a slightly backward and upward direction. And as you do this, you will notice the milk starts flowing into the container. Repeat the same technique till you express sufficient quantities of milk or till the breast feels empty. Finally, rotate the thumb and the fingers all around the areola to ensure that all the milk ductules are emptied. If you feel any lumps in your breast, then you need to massage or apply hot fermentation to release the milk. An important message to make a note here is, when you want to feed the expressed milk to your baby, I always recommend using a spoon or a palada. I do not recommend feeding expressed breast milk using a bottle. This has been shown to cause what we call as nipple confusion. A bottle-fed baby sucks, but a breastfed baby suckles. A baby who's used to sucking from a bottle with a nipple begins to start finding it difficult to suckle from the breast. This could happen even if your baby previously used to breastfeed well. Hence, I would like to insist that you avoid a bottle with a nipple while feeding your baby. To conclude, here are some takeaway messages. Expressing breast milk by hand is economical and most convenient. You need no equipment to manually express breast milk, and hence the contamination is very low. Choose a clean steel or glass container to collect expressed milk. Wash your hands and breast before expressing. Follow the technique that I have shown you to express the milk from your breast, which is simple and easy. Finally, the message that I would like to leave you with is not to be anxious and worried about expressing milk. It is not as difficult as you think it is, and it gets much better as you learn to do it on a daily basis. It only needs a bit of practice, after which I'm sure you will be able to express adequate quantities of milk. So don't worry and stay confident. You can do it.